Hello, good afternoon. I am Dr. Anirban Biswas. I am a diabetologist. I am practicing at Fortis CDoc Hospital. Today I am going to discuss with you a few facts about diabetes. As you all know, friends, that diabetes is one of the leading causes of morbidity in India. And basically, there are two types of diabetes. One is type 1 diabetes, which is insulin dependent and is usually occurring in kids, small children. The other one is type 2 diabetes, which is mainly in adults, and it can be controlled without the need of insulin. Now, first of all, we should focus what are the symptoms of diabetes. The symptoms of diabetes is that suddenly if you feel that you are feeling weakness, lethargic, and you are not able to do your day-to-day activities. Second is that you are feeling irritable, you are having disturbance in sleep, you are having excessive of thirst or hunger, you are going many a times to the loo as you are not doing it earlier, you have frequent breakages in your sleep and you have to go to the toilet every time, even at night time. You may have a non-healing ulcer or skin infections which are not healing. You can have some other problems like visual disturbances also, and urinary infection or chest infection which is taking a lot of time to heal. All these symptoms can lead us to a diagnosis of diabetes. A sudden loss of weight is also seen in few patients. So if you have diabetes, the best test to do is fasting and PP sugar. The fasting sugar should be less than 110, and the PP sugar, which is done 2 hours after taking a breakfast, should be less than 140. If one of them is high, then it is known as pre-diabetes, and then we follow up with a HbA1c test. HbA1c test is a glycosylated hemoglobin, and it tells us about the average blood sugar which is present in our body in the last 3 months. It should be less than 6 in case of a normal individual. If it is more, then you are either a pre-diabetic or a diabetic. So now coming to the treatment and the modification part. So the first thing, as we doctors advise, is insulin resistance is there. So to break the insulin resistance, we have to lose weight. For that, we have to regularly do exercise and take control in our diet. The diet should be such that it should include all the coarse grains and milk, fruits, vegetables, and sprout salads, etc., and less of fatty, oily, high carbs, sugar, maida, processed food. This should be avoided. The other focus should be on exercise. As we all know that even a 30 minutes of exercise or even taking 10,000 steps a day can reduce our insulin resistance drastically. If we can do these things and it controls our sugar, then it is very well. Otherwise, we have to take medicines, and for that you have to visit any doctor. The complications of diabetes, basically it is known as a diabetic tauopathy. Diabetes is basically a vascular disease, so it has a microvascular defects which causes disease in the retina, and the small vessels of the heart, brain and kidneys are involved, and because of this the patient visual acuity can go low, and that is known as diabetic retinopathy. It is usually diagnosed by frequent eye checkups. The second thing can be kidney disease, which is known as chronic renal failure. For this also you have to go for the KFT test, or even a better test is there which is known as microalbumin creatinine ratio. And the third is diabetic neuropathy, which causes pain and tingling sensation in the nerves. For this we have to take some medicines and vitamin B12 supplementation along with diabetic medicines. Thank you. If you have any queries or you need to consult me, then you can consult me through Lybrate. Thanks a lot.